I'm with Joan Bye. Joan, welcome. Thank you for talking about your story. And this is also a crusade you've had, we might say a crusade, a battle which goes back to 1978 with the pharmaceutical industry. Now, the subject that we're talking about in this particular program with Joan is the experimentation on children and the inappropriate administration of drugs. Now, Joan, in 1978, your daughter, Eleanor, who was, what age was she at the time when she tragically passed on in 1978, Joan?
She passed away just before her 13th birthday.
Just before her 13th birthday.
So she was 12.
12. So she was born in 1966.
Yeah.
Now, Joan, you believe that she lost her life as a result of the abuse of the drug Epilim. Now, tell the viewers what Epilim is used for, and why it was administered at that time for your daughter Eleanor.
Well, she was diagnosed with epilepsy, and there was no evidence at all for epilepsy. And I'm doing this broadcast to make the public aware. Your voice is fundamentally important when your child is ill. You know your child even better than the doctor. He may be professional, but there are many things that he does not administer himself to regarding the drugs that are prescribed children. Most drugs prescribed to children are unlicensed, so therefore one must be very cautious the way they're prescribed and administered to children. Tragically, my child became a victim of sodium valproate Epilim. My husband worked for social service and realized the children were coming in damaged and they had been on Epilim, and he couldn't live with his conscience, and he couldn't speak out because, as we know, people in a professional position cannot speak out and give the truth what's going on. Unfortunately, it's common practice right through the system that it's more than what your job is worth if you speak out against a medication that may be harming your loved one.
You've used the term, Joan, now I want to be, this is a very, very sensitive and obviously very controversial subject, but you've used the term guinea pig.
Yeah.
Would you say that your daughter, Eleanor, was a guinea pig for a drug that they weren't altogether sure about?
Well, it was an experiment on the side effects of the drug Epilim. Now, the reason why we use the word guinea pig, and if one looks at the internet, the big story is there, the Academy of the Guinea Pig Children. And if we are on drugs that are on trial, which the doctor receives considerable financial rewards for using your child or anybody when you're there, these drugs are on trial. Unfortunately, my child became a victim of that, and as her daddy was totally aware what had happened, and realizing if he spoke in his position in social service, he would be struck off. So he packed his job in, and we've dedicated our life to save children who the innocence and the vulnerability of parents who believe and trust the doctor. If you feel at any stage in the clinical management of your child, remember the research, you are given the instinct of motherhood and parenthood. You will realize the instinct of motherhood and parenthood very often can show a way how these drugs are being used for research, and your child becomes a guinea pig.
Joan, you've been giving interviews and campaigning since 1978, so that's 47 years.
Yes.
47 years, because I was born in 1979, and I'll be 46 in December. Joan, just to recap with the viewers, what was your daughter Helenor's situation at the time? What was her medical situation? Why, just to recap, was she given Epilim?
Well, the paediatrician insisted that she had epilepsy. Having gone through all records and experience with our knowledge and understanding, there was no evidence, and it was outruled by the coroner's court. There was no clinical evidence of epilepsy. So therefore, she was on a drug. Number one, she didn't need it. Number one, the drug was on trial. So any child that was prescribed this medication could suffer serious harm.
Yeah.
Brain damage, mentally retarded, and unfortunately, causation of death.
And she was 12 years old, Joan, at the time?
Yes.
Yeah. Now, this may seem like obviously you were distraught, but what happened, in a nutshell, what happened over that 12 months that followed your daughter's passing? What did you go through, and what actually transpired? What happened over that year that followed her passing?
Well, first of all, our main concern was our son, who could not believe, my sister, what death was and how difficult it is. He really thought I left her in the hospital, and he was very angry with me. I tried to explain, but how do you explain to a brother or a sister that his little sister has died, and he can't explain what death is? This is a traumatic time for my son, and so we tried to be as diligent as we could to keep him in a normal way of living, as we'd always been.
Yeah. Almost impossible. I mean, it just seems so
unbelievable, really.
Yeah, and I was going to say pointlessly tragic, but we still believe, we do believe that we are going to, you've already had some breakthroughs, haven't you? In your crusade,
I've spoken in Parliament, and we've had the adjournment debate of no duty of candour, and these are issues that seriously need to be recognised, that when parents take their child to hospital or whatever, maybe GP, but of course they don't visit home now, which is a very sad reflection of the downfall of the health service.
Are we saying that the GPs don't visit homes at all now?
No, they don't. And therefore, how important it is, you speak to any high-profile consultant that has humanity in his belief that seeing a home environment can help the doctor to find out what kind of service I'm going wrong.
Yeah, no, I hear you. Joan, going back to Epilim, the drug that you believe ended your 12-year-old daughter's life back in 1978, what is the current status of Epilim as a drug? Because this is an interesting one, isn't it, Joan?
Yes. Well, now they no longer prescribe Epilim to children because they have realised there are serious problems with it and causes many conditions that the child never had. So the drug is now no longer being prescribed after thousands and thousands of babies and children have died needlessly. I think that the National Health Service has got to begin to realise the patient's voice is as important as what the professional is. And if we work as a team, it will be in the interest of humanity in medicine. Sadly, this is not the system, but it needs to change. And arrogance, there's no place in the medical profession for arrogance. Arrogance has been the core of our problem in finding out exactly what happened to Eleanor. It's now known to cause autism, and as we now know the breaking news of the COVID vaccine, millions of children have now got autism, which is a sad reflection on the abuse of drugs and medication and vaccination on children. Is a national scandal. It's time for somebody to raise it in Parliament and have a voice heard in the interest of humanity and medicine. Our main cause at the moment is there are some doctors that would like to speak out. Professor Peter Gray in Cardiff University Hospital was fully aware when he witnessed Helena arriving at his hospital. She was clinically dead. But in his profession, he was not allowed to admit that, so put us through a trauma in believing they were trying to save her. During that time, Dr. Connie Weaver, they were taking her body parts, which at a later date we found in Oxford, her brain, body parts in Bristol in 2 hospitals, and the University Hospital of Wales, we found body parts, and the only man with courage, with tenacity and wisdom was the hospital in London, where the consultant there admitted there was serious cause for concern that the drug Epilim was responsible for the death of Epilim Bye. Telling this story is not easy, but I feel I owe it, and my precious husband, we owe it to humanity and medicine that we can bring about change in the attitude of the abuse of medical drugs within the medical fraternity. Some doctors are getting very rich in using drugs for research. It's not a business, it's a health service. Unfortunately, greed overtakes some consultants and doctors, and they will go to great lengths to use patients as guinea pigs.
Yeah. Joan, can I just cut across there and ask, are you in touch with, or rather, how many people do you know of, or are you in touch with, that believe that somebody, a loved one of theirs, was also, we're going to use the word killed, by this particular drug, Epilim? Do you feel you're obviously definitely not going to be alone? Have you met any others? Are you in touch with any others with a similar crusade to yours?
There's been many programs on the internet and in Parliament. There's one mother, bless her, and fortunately it hasn't broke the relationship of mum and dad, but they've got five damaged children with the drug Epilim. What has made us very angry, I contacted the Royal Paediatric Association to inform them that we have given millions and millions of pounds of money to the McCanns, and the victims of these medications, Epilim, sodium valproate, they still have not received their full compensation. It should be attended to as a matter of urgency. If you have a child at home that's not like another child, it is being damaged by medication, it's a hard task for even having one child damaged. It breaks marriages, the pressure on, but I am absolutely appalled that the McCann's case, how can two parents, highly qualified, cause such harm and paid big money to carry on looking for dear Maddie?
Joan, yes, I know people who've really researched and dug on the Madeleine McCann case. I'm going to say I'm a little bit out of my depth with it because I haven't researched it to the same extent. But now I just wanted to mention, many people will be familiar with a huge YouTube channel, Dr. John Campbell, very well known. Now, Dr. John Campbell is somebody that you have quite a bit of respect for and faith in, isn't he, when it comes to scandals and subjects like we're dealing with in this particular interview, Joan?
Well, John Campbell admitted in the early days he agreed with COVID, but as time went on, and a knowledgeable gentleman, he realised there was serious cause for concern that COVID was causing serious problems. And this highlighted the issue of Epilim with us and many other drugs that cause serious harm to children. And our schools and teachers are unable to cope with it, and they blame the parents of the bad behaviour of the child, not realising the child has a brain problem, which has been, and it's time to expand and recognise these children suffered a living life of hell, really, because their children can be a bit unkind.
There has been I'm going to use the word explosion in the frequency, the amount of autism in the last 20 to 30 years, hasn't there, in children?
Well, I grew up, I'm one of a big family, and every one of us never had all this medical concoction, which is what I call it, and a daddy. We don't need it. Good food, a good education, and where there are some people that need a little bit of help and guidance, not drugs. We are destroying the union between doctors and parents when they feel they no longer can trust their doctor. And I felt like that, and still do, that if somebody had only listened to her dad and I, Eleanor would be with us today. How many more million children would be with their mum and dad if they'd been listened to? God's grace gives us the instinct of motherhood and parenthood. Use it. Don't make a fool of these people. They may be educated, but they have an agenda. They're very fond of money, some doctors.
Joan, just to conclude this particular discussion, you've given a really good, concise, clear summary of a huge story, huge subject, which now for you goes back 47 years to 1978, when your 12-year-old daughter suddenly passed away because of what we're talking about, a drug called Epilim. Now, for those who want to look further into this, to support you, to reach out to you, to, well, learn more, to act on this, can you just give the viewers once more your full name and just a pointer as to where they can find you, things about you on the internet? Where do they need to look?
Well,
what's your name?
My name is Joan Bye, B-Y-E.
B-Y-E, Joan Bye.
Yes.
Mrs. Bye. Yeah.
Yes.
Yeah.
Mrs. Joan Bye. Sadly, my husband's death was unfortunately another abuse of power within the lockdown.
5 years ago.
I'm not going into that, because that is a big problem. How many people have died as a result of COVID? What I will say to you, if you look on the internet and look up the Academy of the Guinea Pig Children, Joan and Derek Bye, it's
Right.
quite long, but it's worth reading, and it may ring a bell with what you've endured and deserve better than what you've experienced from the medical establishment. I think we are human beings, not guinea pigs for pharmaceutical companies who make billions and billions of pounds. It's time to move on, where humanity will reign triumphantly over insanity, which is obviously what has been going on for generations.
You've got a way with words, Joan, but I think you're fairly experienced now in talking about this. Unfortunately, we will have to conclude it there, but thank you so much. I've learnt a lot, and this is not only poignant and heart-wrenching, but massively informative, and I'm really excited to see where this is going to go now, and what breakthroughs we can achieve for you, and who's going to see this. Thank you very much, Joan.
Well, what I'd like to see, that they should honour the funding to the victims of Epilim. They found money for the McCanns. It's now time to find the money for these victims of Epilim as a matter of urgency. I pray you would see common sense in this. These families need support, help, to help them to move forward.
Thank you so much, Mrs. Bye.
Thank you.
And that was Joan Bye chatting with me today. Joan Bye, that's Bye.
Yes.